Hello, my name is Pauline RN. Welcome to my channel. Today we are doing peri-operative. This is part 2, questions and answers from RN Nclex examinations. Please hit the thumbs up button. Please subscribe to my channel. Please share my video with other classmates. Thank you. My first question: why do we give the patients warm blankets after surgery? The correct answer: prevents hypothermia. Patients after surgery, they are very cold, they are shivering. From the OR, the patient goes on to PACU, post-anesthesia care unit. That's your answer for your warming blankets. My next question: what is the responsibility of your PACU nurse? Your PACU nurse, your post-anesthesia care unit nurse. In PACU, there's continuous assessments. There are frequent vital signs, checking patients' oxygenation, assessing neurologic assessments, assessing patients' pain. By then, the patient will have a PCA if ordered by the doctor, patient-controlled analgesia. Patient will be administering pain medication for him or herself. The nurse will be assessing patient's level of consciousness. PCA assessments: we will be assessing patients on a PCA for signs and symptoms of respiratory depression. These patients will be on narcotics, Dilaudid, morphine, fentanyl. The nurse will be assessing patients' urinary output, evidence of kidney function. Post-operatively, we will make sure our patients are avoiding greater than 30 cc an hour. By then, most patients will have a Foley catheter for accurate intake and output measurements. Patients will be getting IV fluids after surgery. Some patients will be alert. We can remind them and start teaching them in PACU how to press the pain pump. They will be pressing that pump for themselves, although they'll be sleepy from the anesthesia. We'll teach them how to use the incentive spirometers to assist them with their breathing. The nurses in PACU will be assessing the surgical sites. Make sure they are CDI, means clean, dry, and intact. The nurses in the PACU will be checking patients for signs and symptoms of hemorrhaging. Patients come back from surgery. Sometimes they are nauseated post-operatively. Patients, sometimes when they are on that PCA pump, side effect of the narcotics is nausea. They will be giving them Reglan IV in PACU or Zofran IV for nausea and vomiting. The PACU nurse will be assessing fluid and electrolyte balance, monitoring intake and output. They will be administered post-operative antibiotics. And some patients may need blood transfusion. Make sure you know if your patients are Jehovah's Witnesses. Okay, that's your answer for your PACU nurses. In the post-operative nurse, they also will be checking the patient's estimated blood loss. We were just talking about blood transfusion. The PACU nurse, post-anesthesia nurse, will be monitoring EBL, estimated blood loss during surgery. If patient needs blood transfusion, they can be drawing labs for these patients. They can give them blood transfusion if they need blood. Make sure you check if they are Jehovah's Witness. Okay, that's it. Next question. For hyperthermia, some patients may experience hyperthermia. What is hyperthermia? The question is temperature greater than 103 degrees. This is signs and symptoms possibly of sepsis. Make sure you are assessing your surgical patient. And sepsis is infection in the blood. Assess, assess, assess. Next question. Post-operatively, patients will need embolism stocking after surgery, or they use a SCD, Venodyne, compression stockings. Why do patients need these? The correct answer is to prevent DVT, prevent thrombophlebitis. Patients will complain of pain in their calves, redness, blueness, pain in their calf. Assess patient for DVT, thrombophlebitis, goes on to pulmonary embolus. This is where they start having difficulty breathing, which is life-threatening. So make sure after surgery they have their Venodynes on, they have their embolism stockings on. Okay, next question. Who takes care of a newly post-op patient? You have a fresh post-op patient on your floor. A fresh post-op patient came up last night, surgery. Today is post-operative day 1. This is a fresh post-op patient because you have to assess surgical size, assess incisions, assess hemorrhages, urine output, very, very important, 30 cc's an hour. Who takes care of this patient? Because a fresh post-op patient is a unstable patient, and the correct answer, the registered nurse is the only one who takes care of this patient on the floor. If your techs take vital signs on all the patients, you, the registered nurse, should be taking your own vital signs on your own fresh post-op patients. That's an unstable patient. You have to do your own assessment. You are completely responsible for this patient, not the tech. If the morning after surgery, the patient gets up for the first time, the tech will not get this patient up. The registered nurse will get this patient up out of bed into chair. The RN is responsible 101% for this patient, not the tech, not the LPN is responsible for this patient. If it's a fresh post-op, the day after surgery, if she's walking the patient, the tech or the LPN can walk along with her left side, right side. But this patient do not walk by herself. The registered nurse walks with this patient to the bathroom. From the bathroom, the registered nurse is the only one who takes care of fresh post-op patient. is your correct answer. I have another question. What is the nurse's role providing preoperative care? And this answer says ensuring all your tests that are ordered by the doctors are completed before surgery with the results recorded in the chart before surgery. Report any abnormal findings in time before surgery, because there's possibility under some circumstances the surgery has to be cancelled. There's another question here. How would you prepare your clients for these surgical events? Sensations preoperatively. Correct answer. The nurse tells the family and patient when the surgery is gonna be scheduled, the time. Sometimes maybe there's an emergency and the patient's surgery is cancelled. Sometimes the families get edgy. When is my mom gonna get this surgery? Keep families and patients in touch. How would you prepare patients for surgical events and sensations preoperatively? Tell them how long the surgery will last. Tell them what will be done, what they can expect during the surgical event. Tell them the sensations they will experience. If you're not certain about answers, call the doctor. Say the family and the patient are asking these questions. Could you come and explain to the patient for me? And the doctors will be happy to. Usually, when the patient signs the informed consent with the doctor would have explained all of this to the patient. But when the doctor is gone, they forget all about it. Then they'll come back to you and ask you all the same questions again. Just call the doctor and say they are asking a second time, and the doctor will come, because it's good for them to have very accurate information, 100%, than you saying 50%. Let the doctor come and tell them 100% what is expected, the events, the sensations, whatever they want to know. Okay, how will we do our pain management after surgery is the question. The correct answer, pain is assessed every 2 hours after surgery. Let patient knows there is little or no pain addiction from the PCA machine, from the PCA machines. Next question is, we're talking about day of surgery. Day of surgery. What do you know about hygiene and skin prep for surgery? Correct answer, the nurse will use antibacterial soap. Patient can shower the evening before or early in the morning before surgery. And the incisional area will be shaved. Don't forget culturals and spiritual considerations concerning shaving. On the day of surgery, what do you know about elimination? Correct answer, enemas prevents post-operative constipation. Cleansing enema for GI surgery. There will be Foley catheter inserted before. So some people will get enemas, suppositories, cleansing enemas, soap, sud enemas the evening before surgery. And if by morning the doctor comes and check their abdomen, the doctor may ask if the surgery is due right away to continue doing some more enemas. Okay, day of surgery. What do you know about nutrition and fluids the day of surgery? And the answer is, it depends on the surgery. The patient will be NPO, nothing by mouth, as ordered by the doctors. For nutrition and fluids, the patient needs to be well nourished for surgery. Patient need to be well hydrated before surgeries. All patients going for surgeries will be on IV fluids to keep them hydrated before surgery. What do you need to know about rest and sleep? For rest and sleep the night before, provide a quiet environment for patients so they can have a very good sleep. Sometimes patient wants a little sleeping pill the night before. You can call a doctor if it's okay. They can get something for sleep the night before. Let's talk about abdominal surgeries. What do you know about dehiscence? dehiscence. Dehiscence is partial or total disruption of the wound layers. If the layers are coming apart, like patient have abdominal surgery, and the layers are, maybe the patient cough or sneeze or turn right, left, or pull up in bed, and the incision is opening out, and you can almost like glimpse the inside part of the abdomen. Partial or total disruption of the wound layers. Notify the doctor. Stay with the patient. What do you know about evisceration? Evisceration. The answer is, viscera can be seen through the incisional area. So these patients with abdominal wounds, you can actually see the inside of the belly just popping out. Moving right, left, pulling up in bed, getting out of bed, just moving, coughing, sneezing, laughing, disrupts the layer. Notify the doctor. Stat. These are emergencies, post-op patients. If this ever happens to you, do not leave the patient's bedside. Always stay with your patient just in case they develop respiratory distress. Stay with the patient. For evisceration, you call the doctor, and while waiting for the doctor, you can use sterile water, sterile glove, sterile water, and 4x4 normal saline sterile glove, and just place it on top of the surgical wound, because all the inside you can see it popping out, just to keep the wound dry until the doctor gets to the room. But do not leave the patient. Okay, that's the answer. What do you know about discharge teaching for patients? Surgical patients discharge teaching. Correct answer. Well-balanced meals. Drink lots of fluids. Use disposable gloves when changing dressings. Perfect hand washing before and after. Please hit the thumbs up button. Please subscribe. Please share this video. Thank you. You will stay tuned to Peri-Operative Nursing 3 after this video. Thank you.